Hello, this is the MSN Evidence-Based Quality Improvement Educational Project entitled Stress Management and Healthy Coping Skills Among Veterans Ages 18 to 64. My name is Anitra Giroux, and this is the summer-fall semester of 2022. Post-traumatic stress disorder, PTSD, can occur when a person is exposed to traumatic circumstances. This type of trauma can cause disturbances to mental health and stability. A person with PTSD may appear to have flashbacks, sleep disturbances, intrusive thoughts, and fluctuations in mood. A person with PTSD may also avoid certain places or situations related to fear of feeling overwhelmed. The population of interest is the veteran population ages 18 to 64 years old. The issue of concern is ineffective coping after deployment and/or military discharge. Many military servicemen have experienced life-threatening and traumatic events. Some veterans may not realize the changes in their personal behavior or inability to cope until they return to civilian life. While some veterans readjust to civilian life without any difficulty, there is a significant percentage of veterans who report some level of difficulty readjusting when they return. This can also have a destructive effect on the service member, their families, and the community. Combat-related stress while returning to civilian life can lead to activities of daily living, and they can affect them as well as lead to the development of comorbidities. If combat-related stress is left unaddressed, this places the veteran at risk for depression, anxiety, alcohol abuse, substance abuse, physical symptoms, and chronic pain. Additionally, other issues can arise such as unemployment, interpersonal problems, and marital conflict. It was also discovered veterans returning from Iraq and Afghanistan are currently at most risk for developing PTSD related to their exposure to traumatic events. An evidence-based project was created to support stress management, the development of positive coping skills, and assistance with healthy reintegration into civilian life. Service members receiving care for PTSD at the Mobile VA Clinic were invited to participate in this project. A literature review was conducted. The most recent literature was reviewed and was within the last 5 years. A multimodal approach to treatment and care is recommended. There is a wide range of treatment options available to individualized care. Treatment is considered most effective when an integrative care system is utilized. You can scan this QRS code on the next slide to review literature in greater detail. In summary of the literature review, it was also determined alternative therapy options such as internet-based cognitive behavioral therapy was recommended as the most current effective treatment option. This method of treatment is said to increase accessibility, is more cost-effective, and will reach more veterans in the community in need of behavioral health treatment. An analysis was conducted in the summer of 2022. In this analysis, the writer interacted with military service members and dependents. A gap in access to care and continuity of care was identified. This writer utilized patient encounters to identify practice gaps and developed a proposed educational plan. A SWOT analysis was also conducted to assess strengths, weaknesses, opportunities, threats, and technology. Direct care was provided to active duty military and their dependents using TRICARE insurance. During these interactions, the patients were assessed, screened for stress and mental health disturbances. This hands-on and real-time experience was beneficial to the development and implementation of the project. During the development of this project, a windshield survey was also conducted. Advanced population health nursing is needed in this community to improve health and the quality of life for the citizens of Mobile, Alabama. There are, however, currently educational programs and free resources to promote health and wellness through the City of Mobile's Parks and Recreations Department. There is also additional resources provided through the Mobile County Health Department and the Veterans Affairs Hospital in Biloxi, Mississippi. The local VA also conducts individual behavioral health services. Community leaders were also interviewed to provide insight on the care and treatment within this population. The data was collected in an urban area in the southern region of the United States. The selected site was an extension of a mental health organization which specializes in diverse mental health services, as well as community health. The patients served include members of the armed forces, patients residing in community group homes, company employees, and members from the community at large. The Mobile VA sees veterans for scheduled appointments, vaccinations, and walk-ins Monday through Friday. Again, data was obtained through patient encounters and treatment to develop and implement this MSN educational project. Nola Pender's health promotion model was the nursing theory selected for this project. Nola Pender's health promotion model would support a stress management and a healthy coping skills development project. The health promotion model is directed at improving the person's well-being. This model focuses on experiences, takes an inventory of cognitive thinking and behavioral outcomes. The goal is health promoting behavior. Personal factors are utilized to influence behaviors. These factors are biological, physiological, and social cultural. The transactional theory of stress and coping was also utilized in this project. This model focuses on assessments in order to evaluate the level of trauma, identify triggers, and barriers in coping. It is effectively evidenced in this model by the client's reassessment and emotional adaptation to the situation that this can be an effective strategy to assess a person's stress level. The writer also used the triad model to identify key factors and considerations within this project. Media reports, close contact with traumatic situations, and access to potential harmful objects was identified as the agent in this triad. History of mental health disturbances, substance abuse, stressful life events, and demographics were identified as the host. And the final factor were season, temperature, economic status, and history of oppression were identified as the environmental factors within this population. The 3 levels of prevention were also identified specific to this population. This information focused the client's screening process and developed preventative coping strategies for the selected population of interest. Again, the 3 levels of prevention were primary prevention, preventing the traumatic event from occurring. Secondary prevention occurs during the period between the traumatic event and the development of PTSD. And lastly, tertiary prevention occurs after the first symptoms of PTSD become evident. The health promotion model was utilized in the implementation of this project. In the literature, it was concluded environmental stressors place patients and staff at risk for mental health disturbances. These stressors can also lead to unhealthy coping skills such as substance abuse, excessive alcohol consumption, and tobacco use. Therefore, the health promotion model was utilized while providing direct care to veterans, dependents, and their staff. The nursing process was followed in this project as well. Community diagnoses were provided. There were 3 community diagnoses and a priority community diagnosis. The project addressed stressors and ineffective coping risk of the population of interest. The barriers to research currently include poor implementation and inconsistency in treatment. However, there are new advancements with alternate care options and a focus on preventative health, which is encouraging. Interventions specifically addressed in this project include exploring coping ideals, identifying triggers, active listening, creating a safe environment, promoting self awareness, and developing healthy coping skills as well as compliance with ongoing treatment. In addition to the health promotion model, the post traumatic stress growth path outlined by the United States Army Behavioral Health Department was incorporated in this plan. This is a measurable model that can be conducted in a clinical environment as well as a community setting to assist with coping and stress management. The stages of progress within this model are deal, feel, heal, and seal. The materials selected for this project were selected with the intention to be effective yet inexpensive. The goal for the facility and or the patient was to be able to obtain these items easily without strain or financial hardship. The timeline for this project was implemented over a course of 4 to 6 weeks. The specifics of these dates will be discussed in the upcoming slides. Barriers and challenges were considered in this project. This includes perception of what others will think, financial and home life challenges, lack of the level of confidence in the VA healthcare system, understanding the benefits of accessing healthcare services through the VA system, and concerns about privacy and security and dependence on the system to maintain confidentiality. Project implementation. The implementation of this project was streamlined. It was structured to be incorporated with the clinic's daily workflow. Many aspects of the project was conducted during direct patient care and during regular clinic hours. During the days of implementation, several workshops were conducted. One was a train the trainer for the provider and the assigned patient aligned care team. The other workshops were conducted with the veterans. A outline of the workshop is noted on the slide. Lastly, the picture on the slide is one of the interactive activities called box breathing. It is utilized to reduce stress and anxiety. It is an evidence-based practice with positive outcomes. There is a high probability the current PAC team will continue to use this program beyond implementation. There has been positive feedback noted from the provider, direct care team, and the veterans. Family members also expressed positive feedback regarding the coping techniques recommended in addition to the psychotherapy. Funding is available to purchase the supplies for the Soldier Survival Kit, which was provided to each participant. The coping tools provided to the veterans will be used in addition to psychotherapy during behavioral health clinic visits. Future recommendations is a multimodal approach for all veterans. There is a need to create programs for all veterans and a design to have ongoing stress management resources through the VA and in the community. There should also be an inclusion of exercise and wellness to the workshops. In conclusion, ongoing holistic treatment for service members experiencing combat-related stress is recommended. Mental health screenings would be beneficial to all service members in active duty, reserve, returning from deployment, and upon discharge. This concludes this presentation References are attached. Thank you.